Welcome back. November is National COPD Awareness Month, and COPD affects nearly 16 million Americans and is a leading cause of death worldwide. In this segment, sponsored by Primary Care Plus, we are joined by Dr. Stephanie Sarrat to discuss the condition and how to manage symptoms. So I guess my first question is, what is COPD?
COPD stands for chronic obstructive pulmonary disease. This is a serious disease of lungs. In this disease, damaged lungs cannot move air in and out of the lungs properly. They're partly blocked. So this increases the work of the heart and it makes it harder to breathe.
So it's a lung issue, but it ends up affecting your heart.
Absolutely. When it's hard to breathe, it's hard to do a lot of things. You know, it's hard to take care of yourself, it's hard to socialize, it's hard to work. So this disease has a big impact on quality of life.
What causes COPD? Is it something you can avoid?
The number one cause of COPD in America is cigarette smoking, so it's definitely something you can avoid. The number of packs you smoke and the number of years that you smoke directly correlates with this disease.
You know, we've all seen the images of how badly your lungs are affected, you know, for smoking for even short but sometimes long durations of time, but how if you stop, things can get better and you can reverse some of those problems.
Absolutely. So smoking causes irritation and inflammation to the lung tissue and increases your risk for infection. There's no cure for COPD, but there are treatments available. You can work with your doctor. There are certain medications and lifestyle changes that you can make to improve, you know, and get better.
Sure. Are there people who have COPD who are not smoking cigarettes?
There certainly are. There are other causes of COPD, things like workplace exposures, you know, to dust and fumes, and also secondhand smoke and smoking other things like pipes and cigars can also lead to COPD.
Gotcha. Well, if you, you know, have COPD or you think you might have it and you're thinking about going to see a doctor, what are some things that your doctor is going to be talking to you about? What kind of plan are they going to try and put in place with you to help you get better?
So some symptoms that might think you would have COPD could be shortness of breath, especially with exertion, chest pains, wheezing, like making a whistling sound when you breathe, and an unexplained cough, especially one productive of mucus. So the number one thing your doctor is going to talk to you about is going to be eliminating the cause of the COPD. So that will be working on a plan to quit smoking, you know, or managing your exposure in the workplace with protective equipment.
Gotcha. So those would be examples of lifestyle changes that you could help to kind of mitigate that COPD and reverse your conditions, make things a little bit better for you.
Yes. You know, there's no cure, but there are certainly things you can do to make things better for you. There are lifestyle changes you can make, you know, depending on your situation. Changes in diet might help, and also exercise could help. You know, exercise is hard to do when you have a lung condition, so you'd have to talk to your doctor about it. But, you know, the right way, exercise can help to strengthen your lungs.
Oh, interesting.
You know, and to make your body use oxygen better.
So there's a lot of ways that you can help yourself. The first of which is getting rid of the reason that you have it in the first place.
Absolutely.
But there are a lot of ways that a doctor could help you. If somebody is looking for a doctor or looking for someone to talk this through with, where should they go?
Well, they should come to Primary Care Plus. That would be great. We operate clinics in Louisiana. We provide primary care services. We value quality over quantity, so your doctor will take time with you and come up with a personalized care plan for you.
All right. Well, thank you so much for joining us this morning. I really appreciate the explanation so we know what things to avoid to try and avoid COPD.
Thank you for having me.
Thank you.